Hi, welcome. My name is Mombi Morito, and today we are going to continue with the topic of mental health, and we are going to deal with schizophrenia. Kindly introduce yourself.
Thank you very much. I am Nicholas Wanjiro. I'm a psychiatric nurse, and just like we've heard in the introduction, today we are going to learn about schizophrenia. So I hope you learn something that will help you understand more about schizophrenia, and in case you have someone who is schizophrenia, you'll learn more something that will help you understand them better.
So what is schizophrenia?
So first of all, in the word schizophrenia itself, you have two words. You have schizo and then you have phrenia. Schizo it means spirit, and phrenia we have mind. So joining the two, we have split mind. However, split mind is totally different from split personality, because most people tend to confuse schizophrenia with split personality, which is totally different. So by definition, schizophrenia is a chronic disorder that affects someone's way of thinking, behavior, and perception as well. So that's a very, very, very simple definition of schizophrenia. So we can know someone is schizophrenia by the way they present themselves. So like I said, it's a chronic disorder that affects someone's way of thinking, behaving, and perceiving things.
So what are the causes, or are there known causes for schizophrenia?
Well, there is no exact known cause for schizophrenia, but we have what we call risk factors. The very first risk factor is what we call genetics. Someone can be genetically predisposed to schizophrenia. That means it can be inherited.
Heredity.
It is hereditary. It can be inherited, or it can be passed in the family generations. Let's say there's someone in their family who have the history of schizophrenia, a grandparent. It can be passed on to the children and to grandchildren. So it's hereditary. Then the other one, we have use of substances. We have drugs, cocaine, heroin, bang, all those things can make someone be schizophrenia, or rather get schizophrenia. Then we have those people who normally get what we call severe life calamities, extreme poverty, sudden loss of things or other properties, sudden loss of loved ones and all that. So that can also predispose someone to schizophrenia. So those are what we call risk factors. However, we might not have what we call the exact known cause of schizophrenia.
So what are the signs and symptoms of, how can you know that someone is suffering from schizophrenia?
Well, there are two major divisions of symptoms of schizophrenia. There is what we call positive symptoms and negative symptoms of schizophrenia. Then, starting with those are the two majors. The two major ones are positive and negative. However, we have another third one, which is minor, which has to do with the cognitive. Are we together? Now, starting with the positive symptoms.
Okay, when you come to positive, does it mean it is helpful, or positive as in helpful?
No. By positive, we mean exaggeration of behavior, exaggeration of behaviors that already exist, or addition of behaviors that are not normal. Giving an example, a normal person is not likely to behave in a way that someone who is schizophrenia is behaving. Right together. So it's addition of foreign behaviors. You're together. I give examples of positive symptoms. We have what we call hallucinations, and we have various types of hallucination. The first one is what we call auditory hallucinations. In auditory hallucinations, this particular person who is experiencing them hears people talking to him, and these people are not real.
Yes.
Voices. So he experiences voices that are not real. There is no what we call external stimuli or something triggering those voices. So they are coming from the mind. So someone can be conversing with an imaginary person from the mind. So he or she is feeling someone talking to him from the mind, or this particular person can hear people talking about him in his mind. It can be 1 or 2 or 3 people talking to him in the mind. And these people, unfortunately, can be commanding this particular person to do things, things that are harmful. They can harm themselves, they can harm others. So that's what we call auditory hallucinations. Then we have what we call visual hallucination. So this particular person seeing things that are not real. Just like I said, there is no what we call external stimuli that is triggering this person towards seeing those things. So it's purely internal stimuli. So this person is seeing things that are not real. You as a normal person or a person without hallucinations can see those things. But this particular person who is experiencing what we've called visual hallucinations tends to see things that are not real. And I've said, there is no external stimuli that is triggering this particular person to see those things. Are we together? Then that type of hallucinations is what we call tactile hallucination. In tactile hallucination, this particular person experiences people touching him or her. So you feel people touching you in as much as there is nothing whatsoever. You feel like someone is touching you. And actually it happens more with ladies. They feel as if there is someone touching their genitalia. Sexually. So they tend to say that I'm being raped. You see things like those. So they experience what we call tactile hallucinations. So they feel as if there is someone touching. You get that? But just like I've said again, there is no external stimuli. It's not a fly that is moving in you or moving over you. It's not a mosquito. There's purely nothing touching you. It's in your mind. You get that? So the fourth one, we have what we call olfactory hallucination. Olfactory hallucination is whereby someone feels or experiences strange smells. You get that? Like now, for example, someone might be claiming to feel the smell of a rose flower, of perfume and all that, but there is nothing whatsoever that is triggering the smell.
There is no flowers.
There is no flowers. There is nothing whatsoever that can relate to the kind of smell this particular person is experiencing. You get that? So you as a person with no what we call the olfactory hallucination, you'll be trying to smell on what this particular person is claiming to smell, but you can't feel it. You get that? So the fifth one, you have what we call gustatory hallucination. Gustatory hallucination is whereby you feel strange tastes. You get that? But again, there is no external stimuli that is triggering you to feel this particular kind of taste. You get that? So those are hallucinations. Then another positive symptom of schizophrenia is what we call delusion. Delusion is having strong inbuilt beliefs that are not in line with people's way of believing. Are you getting that? So when someone is delusional, he or she has very strong inbuilt beliefs that are not real. You get that? Beliefs that are not in line with people's way of living, or they are not in line with people's way of their religious life, or beliefs that are not in line with people's way of their traditions.
Can you try reason with this person and tell him this belief is not true, or it is just a belief?
In as much as you can try to reason with these people, it's very hard. It's very hard to do what we call eradicating this belief or removing this belief.
Yeah.
Because this person is strongly believing in those things. So in their case, it's you that is not normal, because you can see or you can believe in the things that they believe are real. We have various forms of delusions also. We have paranoid delusions, we have delusions of religion, we have gladiosity, we have a lot of delusions. Yeah, someone can be claiming to be brother with president. Someone can be claiming to be being chased by Putin, a president of Russia, things like those. Someone can claim that he or she is the firstborn of the president. You get
Or they're
that,
the president themselves.
Or they are the president themselves. Someone can be claimed to be Jesus, to be God. So this particular person expects people to worship him. You see, or someone can be having extreme fear of unknown. So these people live in fear. You hear them saying there's someone who wants to kill me, someone is after my life, someone has just poisoned my water, so I won't take this water, someone has just poisoned my food. See, so he or she is paranoid. Those are delusions. So they have very firm beliefs that are not in line with people's way of living. You get that? Yes. So those are delusions. Then we have what we call behavioral problems. You get that? So this particular person gets what we call foreign behaviors. You get that?
What are foreign behaviors?
Foreign behaviors, like they behave in a rather different way. An example, we can have what we call echolalia. Echolalia, that is emulating someone's word, repeating someone's word. So like now I say something, you repeat it. Someone else says something, you repeat it. So
you repeat it.
Yeah, you
I'm
start
repeating
repeating. Exactly. Like now when I say I'm Nicholas, you just say I'm Nicholas. I love you all.
I love
and you
you
say
all.
I love you all. You see? So there is that repetitive behavior of my words, my speech. Then you have what we call echopraxia. That is trying to repeat what I'm doing. You can try to repeat my walking style, my way of moving hands, my way of moving head. You see, so those are behaviors. Then you can. There are a lot of. Then you can have what we call. You can be easily irritable. You can be irritable for no reason. You get that? So you express your irritation in a rather exaggerated way. So when I try to understand the reason as to why you are behaving the way you are behaving, and that will be by equating the situation at hand with the way of reacting, I don't see any connection whatsoever. So those are the behaviors. So they become easily agitated. Some of them can be even destructive. You get that? So they start breaking things. They can become vulgar. So they change in their behavior patterns. And finally, some of them acquire what we call bizarre behavior. You get that? Bizarre behavior, like they start collecting trashes or rubbish. You see them in the dusty bin, collecting things, papers, wearing on a lot of clothes, wearing shoes that are in an opposite way or that are not the same, wearing like 5 pairs of socks. You get that? They might come to your house, you've swept it or cleaned it very well, and they start bringing in what we call dust. You get that? Dirt. They start disorganizing the room. So they start behaving in another bizarre way. Those are what we call bizarre behaviors. So that's another positive symptom. You get that? Yeah. So I hope we are still learning. Yes. What is the negative symptom? A negative symptom by definition is deficit of normal functions. By that I mean this particular person should be having particular kind of responding to situations or even behaving, but this particular person doesn't have those normal traits, or those normal character, or those normal behaviors. Let me just say behavior. So there is absence of what is supposed to be there as far as responding to situations, to stimuli and all that, that a normal person should be having. I don't know whether it's understandable. So there is the absence of normal functions. And I'll give an example. I'll give examples rather. Very first one is lack of interest. Someone might not be interested with the surrounding activities. You get that? Whether they concern them or they concern people at large. Then there is lack of motivation. This particular person has been very productive in his line of duty, or in his or in his profession. Then all of a sudden he becomes not motivated at all. He's not motivated.
He's not motivated to do anything.
Yeah, he's just there. Then there is what we call lack of energy. This particular person does have what we call zeal. He's not zealous to do what is expected of him. He's just there. You get that?
Doesn't have the morale.
He doesn't have the morale. Yeah. Then we have what we call disorganized speech. Basically, each and every other person has a normal way of expressing themselves. There is the normal way of communicating. But this particular person gets a rather distorted way of speaking.
Like?
You get that? I'll give examples. This particular person might be having what we call thought block. You get that? Like, he is trying to communicate, but he can't. You see this particular person trying so much to say something, but he's unable to. You get that? Or he talks and talks and talks and talks, and then all of a sudden he just shuts down. You get that? So that is what we call thought block. You get that? Then there is what we call thought withdrawal. This particular person says he's no longer thinking. If you try to ask him, why do you say that you can't say something? He or she tells you that those people, imaginary people, have withdrawn my mind, my memory and all that. You get that? So that is what we call disorganized speech. Then we have what we call like circumstantiality, whereby this particular person talks, but there are a lot of unnecessarily inclusive details that are not necessary. You get that? So this particular person will be talking and talking and talking, although at the end of the day, he or she will come to what we call a conclusive decision. Are we together? So there are more other. There are more other what we call disorganized speech, and naturally we can always be able to tell what this particular person is thinking, or we can be able to gauge this particular person's mind through the way they express themselves.
I thought disorganized speech is okay. There I was thinking like a normal person. It is like maybe you want to say something, then you forget a word and forget completely. You can't even remember it.
Yeah, I've said that is in what I just talked of something we call thought withdrawal.
Oh, it is that.
Yeah, it's thought withdrawal. You wanted to say something and then all of a sudden you can't say it.
You forget completely. You can't even remember the word.
You can't even remember the word.
And what about the, like you say like a sentence which is not fluid, like you say two
yeah,
things that are not like a sentence, and when you look at that sentence, it is not.
We have what we call, still people with schizophrenia, we have what we call clan association. Like now, this particular person just formulates words that are rhyming. You get the we have clan association and word salad. These people use words that are rhyming, just utter words that with a rhythmic flow. You get that? Rhythmic flow. It's like they're trying to rap or something. But these words, if you listen to them, they are very different. Yeah, I don't know if you're getting that. Yeah. So
And those words, are they making sense?
they don't make sense at all. But you have what we call neologism.
Like a sentence with the rhyme, those rhymes.
With clang, association, and word salad, they are real words that you hear. If you listen to them, you know this word means this, that word means that, that other word means that, but they are not related at all. But clang, association, and word salad is different from another symptom we call neologism. Neologism is whereby this particular person formulates words that are not known, that have never been heard. You will see them writing things that are not, you can't understand them yourself at all. By then, there are people who only lives with book and pen. They write, fills one book, keeps it aside, and start writing another one, see like that. But if you try to understand what they are saying, if you try to read those words, you can't read them. So they can be written or they can verbalize it. That is what we call neologism. Yeah. So also that one is in what we call speech what? It's in speech or whatever. Then we have what we call arogia.
What is
arogia is lack of speech. You are unable to speak.
Or poverty of speech.
Poverty of speech, yeah. Yeah. You can't talk. You try to talk but you can't talk. You get that, You're unable to talk. Yeah. So there are other negative symptoms.
So this schizophrenia really affects speech.
It really affects. That's why in the definition you say it affects people's way of behavior. You get that, The way people talk, the way people conceive things. You get that, Yeah. So then the last one we have. So at least we've understood what a positive symptom is. That is addition of foreign behaviors. Then when it comes to negative, that is removal of normal functions that a normal person should be having. And then the last one we have cognitive. Cognitive. Now with cognitive, it has to do with the mind. This particular person's cognitive capability tends to be distorted. There is no memory. This particular person gets what we call poor memory. You can't relate events. You get that.
Can't remember anything.
Event. You can't remember any events. Some of them tend even to forget their people. You get that, So there is their memory tends to be affected or distorted in another bad way. You get that, So they are just there. And also with people who are schizophrenia, maybe I can also add, although this is a negative symptom, they get what we call flat affect. Flat affect.
Okay.
Basically, a normal person should respond emotionally to things in a rather universal way. So people who are schizophrenia gets their emotions being distorted. I'll give a very concrete example. A normal person, when he or she has their loved one dead, what do they do?
Passed on. Of course, you cry.
They start mourning, they start becoming sad and all that. But for a person with schizophrenia, they will not distinguish when the time for mourning is right or when the time for rejoicing is right. Like they don't know when to mourn and when to be happy. They have what we call flat affect.
So they might be happy when they're supposed to.
You might be crying towards something and they are laughing.
Okay.
You might be rejoicing or celebrating towards something, but they are mourning.
So it's good to understand them, because sometimes they may be inappropriate, but maybe they are sick.
Exactly.
And other people might find it inappropriate.
Very true. Others won't express their emotions at all. So you won't be able to tell whether it's like in extreme side of being depressed or being maniac. So they're just there. You can't be able to get there. They don't respond at all to their emotions.
Okay.
Yeah. So basically, in as much as there are others, those are the symptoms of schizophrenia. There are other symptoms.
So those are like some of them.
The ones that I said are some of them, but there are some others. We have some other many. Like now, for example, we have what we call catatonic excitement.
What is that?
Catatonic excitement is hyperactivity characterized by purposeless activities. hyperactivity characterized by purposeless activity.
Explain, please.
A very good example, this particular person can be arranging things. Let's say there are trashes out there. This particular person is sorting them one by one, trying to arrange them. You get that, eh? So there is hyperactivity. Then even this particular person can be pulling their ears, eh? So much to an extent of getting what we call blister. So there is that hyperactivity. You can be acting towards the surroundings. You can be doing something in an extreme way within the surrounding or on yourself. You get that, eh? Or you can be moving your neck every time you're moving your neck up and down, sideways, things like those. So there is that hyperactivity. You get that, eh?
Yeah.
That is catatonic excitement. There is exaggerated hyperactivity. And when that happens, it results to what we call catatonic stupor.
Okay.
As a result of this excitement, this particular person tends to have no more energy towards doing anything whatsoever. So they are just there. You get that?
Yeah.
Then there is what we call towards the flexibility. This particular person acquires a certain particular type of positioning. They still sit somewhere in the very, very same posture for prolonged time.
So they can stay in one position like this, like a statue.
Like a statue.
They
Without
won't move.
moving at all.
Okay.
But this particular person will be aware of the surrounding,
And
what
he's
is
comfy or
happening.
she's comfortable.
Yeah, you'll be trying to hit them, they won't feel it. You try to move your heart on their eyes, they won't even blink their eye. Yeah?
Okay.
However, at the end of the what's the flexibility, these people will come and tell you, why were you doing this and that to me?
So
And some of them can be even
they know what
violent.
you are doing.
They know what they are doing, but they don't have what we call voluntary movement. They're just there. Then others have extra. They are extra vigilant. You get that? They live as if they are waiting for something to happen. You get? They live. Let's say they are seated somewhere. You'll see them focusing towards one direction, as if they are expecting something. Yeah. So they are vigilant. A fly tends to move by the side they are focusing on, and they will tell you. You get that, eh? Then others are paranoid. They live in fear, suspecting every other person, every other thing. And so basically, there are some other more symptoms, eh? on
So can they be
schizophrenia.
treated? Is there?
Yeah, sure. We have treatment for schizophrenia, but worth noting is that schizophrenia is chronic, eh? But in as much as it's
But
chronic,
can it be managed?
definitely it can be managed, and upon management, that's when some people tend to improve, others tend to deteriorate. And upon improvement, these people can take care of themselves. And coming to take care of themselves, people with schizophrenia also have what we call is another important symptoms. Symptom. They have, although it's a negative symptom, they have what we call self-neglect.
Okay.
With that, these people should take care of themselves. What does a normal person do? They wash their body. They have the proper way of living or grooming. Their general appearance should be presentable. Their hair should be combed
So
and
those
all
people
that.
who loiter and we see them, you know,
Yeah.
they are dirty and they collect papers.
Yeah, they
most
have-
of them, they have schizophrenia or any other mental disease.
Not necessarily, but if you look at those people you're talking of, most of them have what we call self-neglect.
Yeah, yes.
They don't take shower, like they're just there. So it has come along because of treatment. Upon treatment, this particular person can have his symptoms improving. So they start taking care of themselves. They will have hallucinations being withdrawn or minimized. They'll have delusions subsiding. You see things like those. Eh? So we have the very, very, very first important form of treatment for schizophrenia is medical. That is what we call pharmacotherapy. Use of medicine. Eh? So yeah, so there is the use of antipsychotics that tends to help this particular person improve. And we have various forms of antipsychotics. We have typical antipsychotics and we have atypical antipsychotics. That is the very first generation. You know, there's the medicine for treatment for schizophrenia that we are invented very early in the time, and now we have newer forms, or newer generations, and these newer generations, the reason that's why they are called newer generations is because they have less side effects than what we call the typical or the very first form of treatment medicine that was invented. You get that,
Yeah.
So there is the use of medicine, like I have said, and as I have said, we have various forms of treatment. We have the ones that were being used in those early days, and at least we have newer generations that have what we call less side effects and good or rather improved what? Improved results. Then we have what we call psychotherapy. This particular person needs a therapist or psychologist, a counseling psychologist or a clinical psychologist to help them understand themselves, so that they can be able to accept their condition and if they are on medication, take medicine so that they are improve, their prognosis can do what? Can improve. Then we have what we call occupational therapy. We have people we call occupational therapists. These people normally tend to help people with schizophrenia or any other mental disorder perform activities like normal people. You get that, Like now, occupational therapist helps this particular person to take care of themselves, if it's bathing, wash clothes, do other things like drawing, you see, things like those. So they help these people do things on themselves or even discover their capabilities. Those are what we call occupational therapists. Then we have religious people for spiritual therapy. I gave an example of what we call derisions of religion. This particular person tends to believe they are Jesus, their God, they should be worshipped. It's not their wish. It's because they are sick. You get that, So, with a spiritual therapist, they will help understand themselves more, maybe explain to them that there is one God whom we should worship, and the reason as to why you are not God and there is that real God is because of 1, 2, 3. You see, things like those. Also to pray for them or pray with them. Then finally, we have what we call family support.
We love them.
We love them. I always say family is the pillar of treatment for mentally challenged people. Because these particular people, or rather the family, will be the one to ensure that this person with schizophrenia have complied to the medication, have taken their medication on time, they are having what we call proper nutrition, because nutrition is also very essential as far as the treatment is concerned. You see those things, So those are the forms of treatment, and they are very essential. Rather, if you look at them, it's I normally call it a collaborative approach, because there's a medical, there's a therapist, both psychological therapies and occupational therapies and spiritual therapy, and then we have the family. So it's a collaborative approach towards the treatment of this particular person here.
Thank you. Kindly say your last words.
So, like I always say, people who are mentally challenged, one thing that is really evident is that we will never fully be able to understand people who are mentally challenged. But if we try each and every day to learn something new, the new things that we learn each and every day is what will help us understand these people and the disorders as well. No one was born known. We all know things as time goes by. And the knowledge that we acquire day in, day out is the one that helps us in understanding people who are mentally challenged. So let us not ignore mental health education, and let's strive towards learning more about mental health. For people who are schizophrenic, they can be productive, they can participate in family activities, they can do things by themselves and for themselves if only we support them fully. If you've lived with a person who is mentally challenged and early along you were not understanding their condition, you were not treating them the way they're supposed to. I always say, like I say, every living moment is a learning moment. And the more we learn, the more we know how to handle people or situations. So that's my word. For people who are schizophrenic, it's okay not to be okay. But the moment you understand yourself, you'll always be good to go. It's good to love yourself, you appreciate yourself, and you'll always be the very, very, very first source of self acceptance. So I wish you well as you take care of mentally sick people and as you learn more about mental health. Thank you.
Thank you so much. You have come to the end of the video. Even me, have learned a lot. Kindly subscribe and let's meet next time. Bye.
Bye. Thank you. Don't forget to subscribe.